all the dignitaries on the dais, Dean and Director, Dr. Shesagar, Dr. Lobo, Dr. Padmaja, and Dr. Swati, and also Dr. Pune Pagar, who was earlier director here, and Dinanath was also here, he is also here, and all the other faculties. It's immense pleasure to be here amongst you. Today, the entire world celebrates, especially our country celebrates a Doctor's Day in the memory of Dr. B.C. Roy, who was a selfless, dedicated doctor who served the society and was also the Chief Minister of West Bengal for a long time. Today we are all in the profession where we pursue our profession also doing service to the society at the same time. Probably this is the only noble profession which serves the humanity and also has a great respect in the society, because people look upon us next to God because we are saving their life. So there is a lot of expectation and lot of responsibility on us as well to live up to the expectation of the people and also work selflessly in the interest of the common people who come to us. It's heartening to know ESIC, which was established by Sri Mallikarjun Kharge ji when he was the Minister for Labour, Government of India. This huge complex health city, we can call it, because we have here dental college, medical college, even now paramedical courses you have started, I believe, with ASI hospital, and also super speciality was also provided earlier. I don't know, you need to evolve more in future. So ESIC has grown slowly. Now I think you are all giving good service to the people here, because if you are seeing at least 800 to 1000 OPDs a day, is a great number in fact, and also this is also as good as a government hospital with no charges. Below 5% of the CGHS is as good as it's free of cost. But still there is a great potential here, because when I go around ESI hospital, I still feel lot of space is vacant here, needs to be utilized. That I think is the responsibility of the dean here, to take up what can be done and what more needs to be done. And I can assure you from the government of Karnataka and from the district administration and also from KKRDB that we will support you. We have been supporting you earlier as well, and we will also support you in the future. Now, I was discussing that there is a proposal for MRI and required. I'll speak to the Secretary KKRDB as well to speed it up. And I also feel that the Dean and Director should also make efforts to start radiology PGs here, dermatology PGs, which are all the faculty which have been left out. You need to restart all of them. You make effort to recruit professors, because you need to recruit the staff for that. So we will be there for you, whatever is required in terms of any equipments or whatever is required. I will speak to the Commissioner as well regarding the garbage issue. And one more thing you told, there is something else you told. A best facility, I will speak to the MD of the NEITC as well. And you kindly give me note like what is required from the district administration, what is required from the state government, and what you expect from KKRDB. Will definitely provide that to you. Because yes, I see throughout the country now, with, he was telling me 11 medical colleges are there. So definitely all ESIC colleges are doing well, I believe. With 150 seats enhanced this year is a more opportunity for a meritorious student because we will be getting more seats. Apart from that, postgraduate seats also allowed here. So NMC has allowed you. This is the first time post graduation. The second year. So for that, I think now enough clinical material is there. But only thing I have an issue with the gynecology department. I was told it's not functioning appropriately. Because you see, my concern is in Gulbarga city, this Kalburgi district, maternal mortality, infant mortality needs to come down to improve our human development index. And for that, we need to have more facilities. Government hospital or teaching hospital of gyms is already overburdened. Nearly 40 to 50 deliveries are done every day. So one more mother and child hospital is coming up by health department in the other part of the city. But in the meantime, I expect you to take the burden here as well, because this also is a free hospital. And I have spoken to the Basweshwar Hospital and MRMC also. They should need to take a part of the burden. Because if some institute is overburdened, you can't give quality service there. So at least if ESIC and MRMC and Kajabande Nawajib, they take some of the load off the government hospital, we can give quality service to the patients. That's what I believe. Apart from that, see, it is all of us are in a very good profession, noble profession, and this being a common setup, still things are good here. But overall in the state, when we see, there are a lot of in recent days, earlier now in recent days, there are a lot of cases on the doctors, there is a lot of medical legal cases are happening. You mean to say that some people are going to court. And also, the quality of the treatment is dropping. That's what is a complaint of the common man, people. And they also complain to me, because when people meet me, they say this. I'm telling, don't take it otherwise. That they are being charged exorbitantly, and they also complain that they are made to undergo various tests unnecessarily, and also there are various things they are telling, like our professional is also slowly being commercialized, which should not happen. Of course, you doctors here, most of you don't practice here because in ASIC it is not allowed. But in other private medical colleges and government hospitals, they are allowed to practice. So a lot of patient poaching is also happening. I was surprised to hear that from many teaching hospitals. They are telling that they are taking patients to their clinics, and all this type of complaints is not good to hear. Because we have some respect in the society. So we need to be above board, like people will respect us when we are working selflessly and we are not commercial or always behind money. Of course, money might be required. Nobody prevents doctors from charging their fees. They are entitled to that. But still, we need to introspect that whenever somebody keeps a trust on us, so we need to live up to that trust. That's what we are supposed to do. So in medical education as well and skill development, we are planning to set up one state-of-art skill center in Kalburgi. and all another 6 places in coordination with Rajiv Gandhi University of Health Sciences. That is a future plan. I believe you have a skill lab here? You are still developing. But it is required here also because students must be sensitized from the beginning in the colleges as well. And they should be taught. Even NMC is bringing some lot of changes. I think you should tell students beforehand that from next year, students who are admitted in 2019, I believe, 2019, I believe, they are going to take next exam. So there is a lot of changes which will happen. You need to sensitize the students about that, and we should prepare our students for that, because the entire system is slowly changing. Earlier, when I took over as a Minister for Medical Education in 2013, there was a lot of uncertainty. The system was not so stable. But now after NEET, the most of the things are streamlined, and everything is merit-based now. So, medical profession is one of the most sought-after professions. Still, students go for NEET in a very big way, and there's a lot of competition here. So, imparting quality education to students should be our priority as well, both in terms of classroom teaching and also skill. And apart from that, they need to be exposed to the patients as well. I don't know how. Now I think enough clinical material is there in ESIC as well. So only we need to establish more institutes here. That's our future plan is there. We are also planning to set up a super specialty hospital in the government sector, which I had started 5 years back. I think last 5 years it went in and going. Still no progress was done. Now we are again taken it up. We are planning to establish within a year one super specialty hospital in the government sector, and also we are planning to start a trauma center in Jim's hospital within a span of 3 months. And we are also expecting to inaugurate Jaideva Institute of Cardiology branch, Kalburgi branch, which is a 371 bed. We have named it a 371 because of the great law here, which is Article 371J, which protects this area, which was done during Mallikarjun Kharge ji got this law passed. So we are doing a 371 in the memory of that 371 bedded Jaideva Institute of Cardiology, which I have given my officers a deadline of January.
Hospital, and he waited very patiently for all of us to gather here. I express my apologies, sir, for starting late, because our doctors were either in OT or OPD. So I will just let our Honorable Minister sir know some good things about ESIC Medical College Kalburgi. That actually in the COVID also, our ESIC Medical College Kalburgi was dedicated COVID hospital, and it has served the people of Kalburgi and around Kalburgi, Yadgir, and it has served a lot during the COVID era. After the COVID pandemic also, our bed occupancy is going continuously increasing. It was very less after COVID because it was designated COVID hospital. Now it has crossed 70%, and also our OPD is also crossed 1,000. Now it is almost 1,200, 1,400, 1,500 sometimes. And our total number of beds, physical beds also we have increased to 630. This year, we have got permission from the Medical Council of India to admit 150 students. So it is a boost for the state students who are getting admission. Earlier the number was 42, now 60 state students can get admission here, and our IPs, 68 IPs can get admission, 22 All India students can get admission here. Likewise, we have applied for postgraduate courses, and we have started, or we have got LOP to start PG courses in various departments. We have got PGs in medicine, surgery, OBG, then ophthalmology, pediatrics, microbiology, biochemistry. We already have PG courses in community medicine and ENT. So total 28 seats we have got this year, and we are expecting to get PG courses in anesthesia also. Likewise, we are increasing our strength of the nursing college. This year, we were having only 40 admissions in the nursing college. From this year onwards, we will have 60 admissions for the nursing college. Also, we are going to start PG courses in dental college in the next year. And we are having 6 plus 2, 8 diploma courses of paramedical college. So these courses these are diploma courses, so we are going to apply to the university, and these diploma courses will be converted into degree courses. So all this progress is happening, and I can proudly tell that all my colleagues, all the doctors here, and the nursing and paramedical staff here are working hard to get these achievements. Of the CT charges, which is very minimal. We are charging, I think, 40 rupees something for CT scan.